Glaucoma can be treated. It's not something that's curable, unfortunately. It's not like cataract where we can do surgery and completely remove it. Unfortunately, that's not the way we treat glaucoma. Glaucoma is more of a chronic disease that we follow over time, very much like diabetes or high blood pressure or cholesterol, that we just have to manage and make sure it's under control. After we screen for glaucoma, we usually decide, is this something that we need to treat, or this is something we just need to closely monitor? So you may hear terms like borderline glaucoma, just the beginning of glaucoma, or we put a diagnosis on it called glaucoma suspect. If you fall into that category, we usually can safely monitor you, granted that you come in for your regular follow-up so we can check your eye pressure, do the different testing about your peripheral vision, about the optic nerve, and make sure it stays the original state and not getting worse beyond what aging would cause. However, if we do notice already damage in the form of optic nerve or in the form of peripheral vision, we may decide this is time to start treatment. So glaucoma treatment is a whole spectrum. Patients always ask me, once I'm diagnosed, what do you do about glaucoma? Right, everything about glaucoma treatment is actually focused on managing your eye pressure. Like I told you, eye pressure is an independent measurement of the eye. It has, for the most part, nothing to do with your blood pressure. And in general, when it comes to glaucoma or prevention for glaucoma, we like low pressure. We do not like high pressure. The lower, the better, and usually you can't have too low of a pressure. So we have a spectrum of treatment options where we can do to manage the eye pressure and bring it lower. At the beginning stage, where your glaucoma is very mild and your eye pressure is not extremely high, we usually have two options available, where it could be in the form of a non-invasive in-office laser, or it can be the classic eye drops that we offer to people. I'll talk later on specifically about the different lasers we offer for glaucoma, but specifically eye drops and non-invasive laser are usually the first steps that we take. Then if you choose the drop route, we would start with one drop, maybe at once a day, and we can increase to different drops several times a day. So in severe stages, glaucoma managing by eye drops may mean you have to put 3-4 different kinds of eye drops into your eyes several times a day. So it actually can become really cumbersome and occupy your entire day. You're just there using drops all the time, which can make it such an issue for a busy lifestyle. Or even later on when you're using drops, there may be other issues, other medical issues, such as like easy things you can think of, arthritis and things like that. It may be just difficult to squeeze that bottle to get the drops in the eye. And some people are just naturally not super good at putting drops towards your eye. So eye drop eventually, sometimes even at the beginning, but eventually may become too hard to use. So there is other ways that we could manage eye pressure as well, which is the next step. We would call that minimally invasive glaucoma surgery or interventional glaucoma. A lot of the interventional glaucoma procedures are very micro-incisional. For those of you who's already gotten cataract surgery done, these type of surgeries for glaucoma, the minimally invasive, or you may hear terms like MIGS, are such surgery that it's even faster than your cataract surgery, and usually the recovery time is faster as well. And again, the goal of that is to lower your eye pressure. It shouldn't affect your vision, it shouldn't make it worse or better for that matter, but it's done in a very safe and controlled situation in the operating room. For those of you who have not had cataract surgery done or do not need them yet, cataract surgery actually will be an opportunity where we can group a lot of the minimally invasive glaucoma surgeries together with your cataract surgery to make it a very efficient process where it's only one surgery, one anesthesia, one trip to the operating room where we took out your cataract, improve your vision, and at the same time also do procedures to improve your eye pressure. That would be more of the intermediate step should the earlier steps of drops and laser fail. Then later on, the effect of these minimally invasive surgeries do wear off over time. We're not promising that once you have this with your cataract surgery, you'll never have to worry about your eye pressure again. Usually, and generally speaking, that is not a true statement for any stage of glaucoma. We can never do something and forget about it. Everything we do for your glaucoma is just like how you manage your high blood pressure, how you manage your heart issue, your blood thinners, your cholesterol medications. It's something we just constantly have to be on top of the game and manage it and try to get ahead of the problem. So minimally invasive glaucoma surgeries do wear off over time. Once it gets to a point where the effect of the surgery is no longer good enough for your glaucoma, then we have to move on to more invasive procedures. Nowadays, there's so many other interventions that's happening on a daily basis. Recently, we had a medication implant approved by FDA, where Harvard Eye is one of the earlier sites to adopt to this, and the medication implant can carry medication in it, and we can insert that into your eye in a surgical process, so you don't have to worry about using your eye drops all the time. It helps to make sure we ensure there's always medication and treatment of your eye pressure, regardless of whether you're on a vacation or you somehow just forgot about using your eye drops. More invasive glaucoma surgeries in forms of having implants and things like that in the eye is more reserved for severe cases of glaucoma, which we hope that most of you, vast majority of you, will not ever have to think about. Because nowadays, as we screen early, treat early, we really try to tackle this disease in its earlier, mild to moderate stage, where we could use these less invasive procedures to control without having to later on moving to more invasive surgeries with higher risk.